Good morning, PT on Ice Daily Show. My name is Dr. Jessica Gingrich. I am one of the TAs with the CMFA Pregnancy and Postpartum Division. And today we are going to talk about toileting habits, something that is very near and dear to my heart. But before we dive into all of the fun toileting things, we're going to talk about the next CMFA Pregnancy and Postpartum courses coming up. So our next online cohort begins November 1st, and our next and last live course is going to be November 19th in Concord, North Carolina. So this is our last course of the year. So if this is something that you've been waiting on, go ahead and head over to ptonice.com to sign up for that last course. We would love to have you. Okay, let's talk pooping. So most people know what it feels like to be constipated. Or on the other end of the spectrum, to have diarrhea. What we know is constant bearing down can lead to symptoms of heaviness or pressure in the vagina or the rectum. It can also lead to urine leakage and also pelvic pain and hemorrhoids. It can also lead to further difficulties emptying or defecating. So asking about toileting habits is an easy assessment tool to incorporate into your practice and will give you a lot of information. This can be a topic, unfortunately, that is really uncomfortable for people to talk about, whether it is the patient or even the provider. So starting getting comfortable with words like poop, bowel movements, stool, and hemorrhoids should be something that is becoming a part of your practice, especially if you are treating or suspecting that someone has pelvic floor dysfunction. So some things that you can ask about is the consistency of stool. This is a great way to get information about just maybe things that they're eating, drinking, maybe even some gut health stuff that you can refer out to a dietitian. So a great objective tool is the Bristol stool chart. So this is something that can easily be Googled, printed, laminated, and just maybe not hung up in your office, but somewhere where you can easily pull it out, hand it to your patient, and ask them where they fall on it. There is type 1 to type 8. So type 1 is that hard pellet-like stools. This is typical with reports of constipation and difficulty emptying. So these are the clients that are going to answer yes to if you ask them if they bear down. So yeah, it's really difficult, or maybe I am able to get a little bit of stool out, but then I just kind of feel like I'm not empty. The other end is going to be type 8. Type 8 is the very loose liquid consistency type stool. This is diarrhea. This can be difficulty for your clients to maintain. This is a tough one. If you have a client that is not leaving the house or not exercising or something because they feel like they're going to lose their bowels, that can be pretty significant. Types 3 and 4 are considered normal. So the second thing to ask about is frequency. So normal defecation is interesting. It can be 3 times per day, so after every meal, to 3 times per week. That is a wide range of normal. And so asking your clients, seeing what is normal to them can be pretty magical. Asking if their normal has changed. And is it accompanied by symptoms like abdominal pain, weight loss or weight gain, changes in the way that they're eating or drinking? This can be really helpful in guiding your plan of care. So now, what do we do with this information? If your patient is a type 1, they are the ones that have that hard pellet-like stool. they likely need to increase their water intake. So another thing to ask about is how much water are you drinking a day? You are going to see people that tell you they drink 40 ounces all the way to 2 gallons of water per day. This is a great educational tool. This is going to be outside of what I'm going to be talking about today, but the topic of hydration to dehydration, and it can look different for everyone. So encouraging them to drink a little more water slowly, so they're maybe taking smaller sips in their day rather than chugging right before bed or at random times in their day. Tracking their water is easy, but also really annoying because it's something you have to think about throughout your day, but it can give you a lot of information. If they report the type 8, so this is going to be the liquid diarrhea type stools, they need to eat more fiber. And so one of our favorite things to say here at ICE is eat more plants, and that is a great place to start. Other interventions include educating on the use of a squatty potty. So elevating your knees improves the biomechanics of the pelvic floor and the rectum. So it will allow the pelvic floor to relax. The rectum will shift shape essentially and be more upright. So less fighting against angles in the rectum in an upright position. Maximizing the function of the pelvic floor is crucial for peeing and pooping. Putting your patients on a pooping schedule. So this is going to be, hey, what time do you typically go to the bathroom? Most people say in the morning, and then have them sit on the toilet at that time every single day, whether there's an urge or not, with their feet elevated. That's going to be really important. Other verbal cues from here are going to be try to just relax as much as possible. This can be really difficult for moms, especially if they've got a crying baby in the other room or a toddler following them around. But staying on the toilet for longer than 10 minutes, they can also try to decrease that time and be more in that 60-second to 5-minute range. And then also limiting your distractions like cell phones or other reading material and focusing on the relaxation, which can include the diaphragmatic breathing. One last piece of objective information that you can incorporate into your practice will be the use of a bladder diary. So this is just another great assessment or objective tool that will give you insight to their daily toileting. This will include their pooping and peeing habits. So it's going to ask them to track their fluid intake, the foods and drinks that may irritate their bladder, and if they pee just in case. So this is some great stuff to just start adding into your practice, especially if you are suspecting pelvic floor dysfunction. I hope this helps. Happy Monday and happy pooping.